Do not start.
So if you want the reference of this article, and you're welcome to read it, it's in the January 2nd, 2014 edition of New England Journal of Medicine. So you can say we're very timely here, providing new cancer information for our listeners. We're going to go to a word from our sponsor, and then we'll be back to take your calls and talk about other cancer news.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway, hits the prostate cancer. Call 212-CHOICES. 212-CHOICES to hit the prostate cancer.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Yeah, we're back. This is Dr. Lederman. I'm here with John Taransky. Good morning.
Hey, Doc. Good morning.
We're at WABC Studios. We're live. If you have questions, you can call us at 800-848-9222, 800-848-9222. If you want any of the booklets I talked about, we're happy to mail them to you if you call us at 212-CHOICES, which is our office phone number, and you're welcome to call during the week. 212-CHOICES, which is 212-246-4237. 212-246-4237. Our office is at 38th and Broadway. A lot of people call and ask us that. Where are you located? 38th and Broadway. Just
prime location.
Yeah, prime territory. We're just a few steps from Macy's or from Times Square on Broadway, 1384 Broadway. We're open pretty much 8 to 5, Monday through Friday. We see new patients. We treat cancer. We give second opinions. We have something called the Urgent Cancer Consultants, where we promise to see a patient within 1 day, so you don't have to wait weeks and weeks and months, because we think when you have cancer, it's your right to get an opinion, a good opinion, a fresh second opinion, quickly and not wait, and then consider your options. We take most insurances, Medicare, Medicaid, so we try to make it as easy as possible for our patients. I want to talk about several more patients that we saw this week. One was a gentleman who had pancreas cancer. He had pancreas cancer. He was losing a lot of weight. He said he was getting wrinkles, and no one was listening to him. But when he was getting wrinkles, he meant he was losing his fat, and the skin was folding over itself. Mm-hmm. He lost about 40 pounds. Finally, he got a CAT scan. Someone listened to him. And he had an 8-centimeter mass in the pancreas. So 8 centimeters is about the size of a fist. Mm-hmm. And it's wrapped around the blood vessels. It was occluding some of the veins, the portal vein, the splenic vein. It was cancerous. It was not operable. He went to a chemo guy. The chemo doctor told him, well, the stage doesn't really matter. We don't know if it's in the liver or not. We're just going to give you a little bit of chemo, tiny chemo. Won't hurt you, tiny chemo. Well, a couple of things are wrong. What's wrong with that? What's wrong with that? Well, number one, shouldn't you know where the cancer is? I mean, in 3 months, you're going to get another test, and you want to know if the cancer got better or worse from the treatment. Well, if you can't tell from your test where the cancer was initially, how are you going to compare that in 3 months?
Yeah, sure. Nothing to look back at.
And the prognosis for stage 1 cancer is different than stage 4 cancer, right?
Yeah, sure.
Every stage is a reason why there's a staging system. The staging system is designed to tell you where the cancer is. So the doctor told you, number one, it doesn't matter where it is. I can't tell you where it is, but it doesn't matter where it is. Wow.
Mm-hmm.
Wow.
Yeah.
Wow.
Yeah.
You know, it does matter where it is. And where it is, I mean, it changes the stage, changes the treatment, and gives you the chance to know exactly where it is. So for this man, mini chemo won't cut it. Mini chemo is not likely to work. He's proceeding with fractionated stereotactic radiosurgery to the pancreas cancer. We've treated hundreds of cases. We've treated about 20,000 patients with stereotactic non-invasive treatment, and our success rate in stopping or shrinking the pancreas cancer or other cancers is about 90% for the life of the patient. So if you want to talk about your cancer, give us a call during the week or after the show at 212-CHOICES, 212-246-4237. And we have a caller, Richard, on the line. Good morning, Richard.
Doctor, I wanted to ask you about this
Good morning.
procedure someone told me about. Good morning, sir. There's a procedure to either remove prostate partially or completely. It's called green light prostate vaporization.
Mm-hmm.
I know that it's. I don't know if they use it solely, for non-cancer treatment or for cancer treatment, but I've been told that it's a positive procedure for those who suffer enlarged prostate or
Well,
I've had a number of urinary blockages.
Right. So there's two different issues that you're talking about.
Green light.
Right. So
Yeah.
there are treatments available for benign prostatic hypertrophy to try to shrink down the prostate. And that kind of treatment is a reasonable treatment that you should speak to your urologist about. It is not cancer treatment. And
I see.
Cancer treatment, there's two basic treatments that are proven. One is surgery, which is obviously proven, but it's not very good and has lots of complications. And then our premium program for people who want the highest chance of being cancer-free, for that cancer to go away, stay away, and never come back. If you look at the data in our book that compares us versus most every major cancer center in America and other techniques, proton beam and IMRT and radical prostatectomy and the like, you'll see that our results are about 10 to 50% better. That includes the major
your treatments
cancer
are solely for people who have some cancer.
Cancer, right. So if you have cancer, God forbid you have prostate cancer, then you should give us a call. If you have just an enlarged prostate, if your PSA is low, or you've had biopsies and there's not much in the risk of having a cancer, then you can do things to treat the enlarged prostate so you don't hopefully...
Well, I have a situation. I've had biopsies have been negative, but as my urologist has told me, sooner or later, probably at a certain... I'm 72. Sooner or later, something's going to pop up.
Well, that's not true, actually, and there's a misconception out there that everyone's going to get prostate cancer.
Yeah, this idea that you're over 75, 90, you're automatic.
That's not true. I know that there's a rumor out there, and a lot of doctors and patients and people think it's true that everyone's going to have prostate cancer. Actually, the rate is about 10-15%.
Anyway,
so it's just not true. If you have an enlarged prostate and it's blocking your passageway and you need to urinate better, then see the urologist. If you want to come in and talk about it, I'm happy to talk about it. We're just about the end of the hour, so I'm sorry.
My urologist himself does not do this procedure, but he recommended that so it is a safe procedure, the green light.
For the right person. So again, give me a call during the show, and we'll then talk about it if you call us afterwards. So it's the end of the hour. I thank you very much for your call. Again, we have the booklets available if you call us at 212-CHOICES or questions or want to come in for a consultation. We obviously urge people with a fresh second opinion, if your cancer treatment isn't working, to give us a call or come in, and maybe we can help you a lot. You've heard about some of our cases this week. If you want to hear about more, you can tune in 710 radio tomorrow between 6 and 7 a.m. or 9 to 10 p.m. every Sunday. We're going to be back on WABC next Saturday morning with John Taransky at my side from 5 to 6 a.m. Again, if you have questions, feel free to call us. If you like the booklet, feel free to give us a ring or come in. You can pick up everything. We're so centrally located. Seems like everyone in New York, there's only 50 million people that visit Times Square. So I'm sure that many
Pop
people...
in, see Dr. Lederman.
Pop in, we'll give you the booklet and even give you a tour of our place if you want.
Yeah, and it's worth the visit.
So have a great week and a great, healthy New Year, and God bless you. Thank
Happy
you
New Year,
for
Doctor.
tuning in.
Thanks.
Same to you, John.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packer. Extreme